Welcome to the fourth session of AristaMD's virtual conference. This session will be presented by Urquiza, Senior Vice President of Operations and Client Experience here at AristaMD. This presentation is called Measuring Practice Success in Patient Care. Eric, I'm going to return to the screen when it's time for questions and turn everything over to you.
Thank you, Kate, and good afternoon, everyone. Welcome to the fourth session of today's conference. I'm Eric Urquiza, Senior Vice President of Operations and Client Experience here at AristaMD. During this session, we'll focus on measuring practice success in patient care when adopting or maintaining an eConsult program. Many of these strategies apply to increasing the adoption of any new technology or program. My goal today is to help you think differently about how to measure and improve the success of your practice and ultimately the health of your patients. Let's start by reviewing a few challenges to effective care and practice success. Primary care providers lack the tools and time to help patients navigate care. The average PCP sees between 10 to 20 patients per day, and patient care is their goal. Adding new technology adds to their workload. At the same time, not getting specialist advice for patients is creating additional work for PCPs. More than 40% of referrals never get scheduled. That means more work for the PCPs as patients boomerang back to the primary care setting with the same untreated condition. Also, 25% of our healthcare costs are for unnecessary tests and treatment. How do eConsults solve these challenges? eConsults are proven to reduce specialty care costs for patients, providers, and payers. eConsults also support value-based care in tangible and practical ways. They create a path to a faster diagnosis and treatment, improve or eliminate wait times for specialist visits, increase access to sub-specialties, and minimize worsened health outcomes resulting from delayed patient care. At-risk practices see tremendous cost savings by eliminating unnecessary specialty visits, reducing ED use, and preventing hospital admissions and readmissions. Let's talk about the best practices for measuring the impact of eConsults for practice performance and patient care. Provider adoption is a critical metric at the program's launch and during the life of the program. Track and communicates which specialties are the most needed by the patient and to increase access. Monitor clinical quality to ensure that eConsults submitted include the relevant information and the responses from the specialists address the patient's needs. I'll give you an overview of how our clients measure patient benefits. And lastly, we'll discuss how to measure cost savings at your practice. Providers are busy. They are rarely involved in selecting new technology and often have limited visibility as to the why they should use a new tool. A successful eConsult launch educates and engages providers on the benefits to them and their patients. There are a few ways you can gain significant adoption. Patient benefits. Outline the benefits to their patients. Talk about wait times for specific specialties in your area. Discuss patient roadblocks like transportation, time off, and childcare. And then care continuity. eConsults eliminate many care coordination challenges by delivering the patient at recommendations to the PCP's inbox. Provider incentives. Provide an incentive to your providers by getting them up and running fast with a little extra cash when they request an eConsult. It increases the likelihood that they will start and continue to use the technology. And last, cost savings. Emphasize the cost savings not just to the practice, but to the patient as well. Now that you got your providers ready, start measuring their engagement. The long-standing management tenet, what gets measured gets managed, is likely influenced by the Hawthorne effect, which holds that individuals modify their behavior when they are aware that they are being monitored. How quickly you see the benefits of eConsults correlates to how quickly your providers access a platform for the first time. AristaMD tells you who hasn't logged in so you can engage these providers or set up additional trainings. The number of eConsult requests should increase each week, but you also want to know that providers are requesting more eConsults. The average number of requests per provider tells you how often users are coming back to the tool. The more they return, the more value they see in eConsults. Every new program needs a clinical champion. Identify your early adopters. They can help spread the word about the benefits of the solution. Find out who your top performers are. Ask top performers for testimonials and use cases. These users are likely to convince their colleagues to use eConsults. These sample AristaMD reports show a trend that we typically see with the new practice. Before we dive into these trends, notice that we work with the approach to identify a goal for active requesting providers and eConsults per month. It's typical to see a few early adopters. As these early adopters see the benefits of eConsults, the pressure builds for other providers to start using the platform. As you can see, this practice did not achieve its requesting provider goal until 8 months after the program's launch. Delayed adoption is a common problem. There are often 1 or 2 PCPs who don't want to engage or change how they practice, which is why it's important to communicate the patient benefits, discuss the value to care continuity and their increased ability to maintain direction over patient care, offer incentives for eConsult usage, and emphasize the cost savings, again, not just to the practice, but also to the patient. These strategies can help you overcome objections from PCPs reluctant to try new technology. The goal eConsults per month is directly impacted by the number of PCPs using the platform. You can increase the number of relevant eConsult requests by educating your PCPs about appropriate use cases for eConsults. We will discuss this more in a few minutes, but the takeaway from this slide is that engaging your champion to advocate for eConsults can increase the number of eConsult requests per PCP and help you deliver faster specialty care for your patients at a lower cost. We recommend targeting 20 to 30% of all referrals going to eConsult. Our research indicates that this range will capture those patients with non-procedural, non-emergent specialty care needs. At-risk practices with usage in this range achieve the maximum cost savings from their programs. To reach this goal, every provider in the practice will need to leverage the program and request eConsult in multiple specialties. One way to evaluate the percentage of patient referrals eligible for eConsults is to leverage our free referral review service. Our team of registered nurses completes the review, who will then review pending referrals to determine those eligible for eConsult or patients at risk of symptom escalation who would benefit from an interim care plan. Interim care plans provide a backstop to ED and urgent care utilization. Our nurses can also submit the eConsult on behalf of the provider and notify the provider when the eConsult is complete. Let's take a look at 2 additional charts. The practice in this chart launched its eConsult program about 6 months ago. The chart eConsult submitted reveals a common problem. Some PCPs often get stuck using eConsults for only 1 or 2 specialties, so the greatest number of users only request one eConsult per month. This would not be surprising or even concerning in the first month or 2 after the program launches. As time passes, however, this could significantly impede your ability to realize the optimal results for your patients and your practice. When you find PCPs submitted more than 5 eConsults per month, you have identified your eConsult champions. I'll tell you exactly who your champions are so you can leverage them to get everyone using the platform and eConsults for more patients. The lifetime eConsult engagement chart reveals a second critical issue. There are a significant number of providers in the practice that are still not using the service. Leadership and your champions need to engage these providers right away. A few tactics we recommend are setting up another training session for the holdouts. AristaMD also sends timely reminders to these providers, including training videos, eConsult benefits, and use cases. Engage your champions. Ask them to share why and when they use eConsults, specific examples of patient benefits, and what types of responses they receive. I personally facilitated re-engagement meetings to review how to use the platform, followed by an eConsult champion presenting a use case. This meeting has a tremendous impact on the PCPs reluctant to use eConsults. With considerable time and effort, at-risk practices identify patients at high risk of serious health events. We want to use the same information to develop an eConsult strategy. Consider which specialties have long wait times, higher costs, address conditions easily managed in the primary care setting, and avoid face-to-face specialist visits. Using eConsults in these situations will drive cost savings, improve patient outcomes, and decrease the risk of ED use, which is a costly alternative to a specialty visit, unscheduled or canceled specialty care appointments, and those boomerang appointments back to the primary care setting. Increasing access to specialty care is the goal. Together, we can track and communicate which specialties are most needed by the patients you serve, likely to improve patient outcomes, which are appropriate for eConsult and valuable to your practice. Merritt Hawkins reports that the nationwide average wait time to see an orthopedic surgeon is relatively short, just 16.9 days. However, looking at the average can be misleading. This average is a 48% increase when compared to 2017. Getting an appointment with an orthopedist varies tremendously by location. In San Diego, for example, averages 55 days. If you're wondering which specialties have the longest wait times in your area, I'd be happy to share the Merritt Hawkins survey reference above and some of our other independent research. Several factors impact appointment wait times. Not all specialists except Medicare and Medicaid specialists are often clustered in metropolitan areas and unevenly distributed across the country. Patients are less likely to schedule and attend a specialist appointment when the wait times are extended, travel distance to the specialist is significant, and/or the cost of the appointment is high. The patient has a high deductible insurance or a specialist is out of network. In addition, patient referrals are often prioritized by urgency or whether they are a current patient. And scheduling an appointment with the specialist is only the first step. Patients visiting a specialist average 3 encounters with the specialist for each condition. When you know your patient population, as most at-risk practices do, it's easy to identify opportunities to deploy eConsult in high-cost specialties. Let's take a look at a few of the more expensive specialties and frequently occurring conditions submitted as eConsults. These common conditions typically result in an eConsult disposition, indicating that the treatment options are available in the primary care setting. In cardiology, eConsults can provide guidance on abnormal EKGs, arrhythmia, and hypertension. Hematology is one of our fastest growing specialties. eConsult volume for this specialty increased by over 50% during the last year. Anemia, leukopenia, and neutropenia are just a few of the most common conditions PCPs use eConsults to access advice from a specialist. In neurology, eConsult can support diagnosing and managing conditions like tremors, epilepsy, concussion, and neuropathy. We see frequent requests that support the treatment of bursitis fractures as well as back and knee pain. An orthopedic eConsult for a metatarsal fracture includes advice like, this is excuse me, a non-operative fracture, or I would counsel the patient to follow a conservative non-surgical treatment plan using a carbon fiber insert in a regular sneaker type shoe or an orthopedic hard sole shoe. Those are just a few examples. If it's not urgent procedural diagnostic, it's likely it can be managed in the primary care setting using an eConsult. eConsult specialists also support patients with chronic conditions and abnormal labs and imaging. Finally, patients with comorbidities are often good candidates for eConsults. To diagnose and treat the patient referenced on the right side of the screen, the PCP would need to consider referring her to as many as 3 specialties: cardiology, endocrinology, and psychiatry. Given the patient's symptoms, the time required to obtain multiple appointments, and the cost of accessing specialty care, a better approach would be to start with an eConsult. In this case, the PCP decided to request a cardiology eConsult, which identified the recent addition of atenolol as the source of her symptoms. The efficacy of your eConsult program can be measured by the number of replaced visits. 79% is a good replaced visit rate. Across all eConsults, we average over 74% replaced visits. This statistic is affected by quality eConsults include relevant clinical details and a specific clinical question. Without this information, you'll see few replaced visits. AristaMD offers 2 tools to help. First, a workup checklist is displayed for most conditions, which tells you what the specialist will need to return a high quality response. And second, registered nurses that curate the eConsult for the PCP. Our nurses have extensive experience, and the eConsults they prepare have a much higher replaced visit rate. The characteristic of the condition also impacts the replaced visit rate. What I'm referencing are issues like a different specialty is needed, and/or the specialist suspects a new or different diagnosis. Although while this does not always mean a face-to-face visit will be recommended, it can reveal an emergent condition. Each avoided visit saves the risk holder between $500 to $1,000 per avoided referral, including a 10% reduction in the number of visits per referral. Studies show that improved access and preventative care decreases disease and mortality. By addressing health problems before they require emergency intervention, both patients and health systems save money and see better outcomes. How do you know the advice you receive from the eConsult is working to prevent disease escalation? Using population health data, like hospitalization and readmission rates and emergency discharges, can give you confidence that your program is effective. Referral volume will decrease as the use of eConsults increases. Reporting from AristaMD offers quality metrics for your practice. Controlling costs by monitoring hospitalization and readmission. eConsults can help prevent hospitalization and readmission by allowing PCPs to build a more robust preventative care plan, address nuances related to chronic conditions, identify patients at risk for readmission, and prioritize interventions. The average hospital stay is $11,700, the most expensive type of care utilization. Preventing even one hospital stay delivers significant shared savings. The 30-day readmission cost is about $15,000 per patient, and about 14% of the patients are readmitted. AristaMD eConsults related to the care of patients following a hospitalization. These requests are often related to chronic conditions such as COPD, congestive heart failure, and hypertension. $8.3 billion is spent annually on emergency department care that could be provided in another location. The Healthcare Cost Institute estimates the average cost of an ED visit to be $1,917. Avoidable visits are frequently related to chronic conditions, particularly behavioral health, diabetes, and hypertension. They are also caused by the escalation of symptoms while patients wait for specialist appointment. Symptoms like chest pain, shortness of breath, and/or abdominal pain. Using eConsults to care for patients you expect will wait weeks or months can reduce avoidable ED visits by offering interim care. 4.7% of eConsults are requested after emergency discharge. The consults are for conditions you may not expect, including dizziness, fractures, thrombocytopenia, which is low blood platelet count. eConsult specialists respond with practical solutions that minimize the risk that patients will return to the ED, medication changes, and mobility interventions. Monitoring patient conditions post-discharge from the ED can reveal areas where an eConsult could have helped avoid an ED visit or better treat the patient post-discharge. Referral trends are perhaps the most obvious way to monitor success of your eConsult program. Referrals should decline and stabilize once eConsults are being used regularly by your providers. During our discussion about provider adoption, we reviewed a chart that showed a peak usage. This peak in usage is the ideal time to educate providers about additional specialties that eConsults can support. My team can provide example use cases and common conditions during this period to improve cost savings and reduce the burden to the patients that come with visiting a specialist in person. I also mentioned that some providers get stuck on one or two specialties. These providers are most likely to benefit from introducing just one specialty for eConsult use. Looking at only 1 month of eConsult trends reveals a lot about the most frequently used specialties. I can also reveal specialties that can be used by providers in the practice. In this practice, I recommended sharing common conditions and use cases related to pediatric specialty care and diabetes management. Comparing eConsult specialties to your referral trends will provide even greater insight. Now let's discuss some of the quality measures referenced on the right side of the chart. More than 90% of AristaMD eConsults influence the diagnosis or treatment plan for the patient. This metric is related to improving patient outcomes. We also tracked how often an eConsult results in a new diagnosis. This statistic and others listed in the chart are reported by the requesting PCP. This is a game changer for patient outcomes. Finally, we ask our PCPs to rate the quality of the eConsult response. The average PCP rating is 4.8 out of 5 stars. Approximately 30% of eConsults result in a new diagnosis. This statistic and the others listed in this chart are reported by the requesting PCP as mentioned on the previous slide. It is also a game changer when it comes to patient outcomes. A great example of a new diagnosis is depression in elderly patients. Depression symptoms in older patients are often like the symptoms of a dementia patient. Highlighting this metric is a powerful way to communicate the program's value to the providers reluctant to expand their use of eConsults. In this case, dermatology is an area where a specialist advice has supported the PCP. Dermatology is also a specialty with notoriously long wait times. Let's look more closely at how using a provider-to-provider consultations benefit your patients. eConsults deliver so many patient benefits. Patients save money with fewer copays, less travel expenses, and reduced time off work. Patient satisfaction improves when diagnosis and treatment is delivered quickly. Equal access to specialty care increases because social and geographic challenges related to care are reduced. Outcomes are also improved when patients receive treatment fast, avoid expensive emergency care costs, and experience a better care continuity. Let's look more closely at how to measure patient cost savings. Visiting a specialist is expensive, and not visiting the specialist can be catastrophic for the patient. The patient saves at least $120 per avoided referral, $40 per visit over the 3 visits typically needed to receive a diagnosis and treatment. Primary care accounts for 5% of the total healthcare costs. Specialty care contributes to 16.5% of healthcare costs. Treatment in the primary care setting avoids copays and care delays that increase costs. The trick is to provide the right amount of specialty care in the right setting. Healthcare Finance News reported that $200 billion, or 25% of our healthcare costs, are for unnecessary tests and treatments. This figure doesn't include unnecessary emergency room visits, multiple visits to your clinic because a patient can't get an appointment quickly, or increased costs of care due to untreated conditions. Let's eliminate these unnecessary costs by consulting with an eConsult specialist to determine exactly what tests are needed and reduce duplicate tests at the ER or specialist office visits by avoiding these high-cost care settings whenever possible. Copays aren't the only cost to the patient that can impact access to specialty care. Will the patient need additional time off work, childcare, or travel a great distance to see a specialist? eConsults can minimize these costs as well. We estimate these costs for our clients. Patient miles saved by avoiding a referral is 45 miles. Patient hours saved just in travel, the waiting room, and during the specialist visit is 4.85 hours. Taking time off work is difficult for those with lower incomes, irregular hours, or the elderly who needs a caregiver to transport them to a specialty visit. All of these calculations are dependent on the proximity and availability of specialty care in the patient's area. Rural patients often travel farther for care. Urban patients are more likely to struggle with social determinants of health, economic stability, lack of reliable transportation, or religious, language, and literacy barriers. Patient savings on childcare is an often overlooked challenge. We estimate this cost at $17.50 per hour for the 4+ hours needed to attend the specialist appointment. That's $84.88 of child care per avoided referral, a considerable amount of money for many of the patients we serve. Let's take a quick look at some of the quality metrics that eConsults can impact and that you can use to measure patient satisfaction. First, we have HEDIS. eConsults increase the effectiveness by obtaining subspecialty advice. The PCP can't possibly keep up with the changing standards of care across every specialty. Patient satisfaction increases because they can receive a care in the PCP setting. This improves patient's experience. It reduces stress for the patient for waiting for a diagnosis. Next, we have star ratings. By coordinating with remote specialists, patients can benefit from specialty advice to access screenings and manage chronic conditions no matter where they are located. We then have clinical quality measures. eConsults are frequently used for medication reconciliation and non-emergent conditions. If the patient is pre-diabetic or has high blood pressure, the PCP can consult with the specialist when the symptoms first appear and adjust the treatment plan with advice from the specialist without delaying care. eConsults enable more efficient use of resources. If the patient doesn't see the specialist, they won't get the care or end up in the ER. This impacts symptom management and patient outcomes, improving patient satisfaction. And lastly, we have CAPS. With timely diagnosis and treatment with the PCP, the risk of contraindication is lower because care is centralized. Plus, eliminating the wait for an appointment with a specialist and the appointment itself increases patient satisfaction. Identifying health inequities can help the practice manage risk and reduce the burden of care for your patients. Increase access for patients who face challenges associated with genetics, including populations that require additional preventative screening, environmental factors like economic stability and transportation, Healthcare, patients without insurance and are covered by Medicare or Medicaid. And individual behavior. Your patient's health is also determined by access to jobs and food, support available in their homes, and work safety. 60% of health-related outcomes are directly correlated to the social, environmental, and individual behavior of the patient. These inequalities are worse when the patients are minority, low income, speak limited English, and live in rural areas. To measure and reduce inequality driven by social determinants of health, you need to identify which patients are most likely to be readmitted to the hospital because of limited access to transportation and/or lack of family support or social support. And then determine if language, disability, or region will impact your patient. Lastly, consider appropriate health monitoring, preventative screening, and vaccines. Offering eConsults and other services like vaccines in your office can reduce inequality for these patients. eConsults improve patient outcomes by enabling the PCP to offer a diagnosis and treatment plan an average of 19 days sooner than a referral. The majority of eConsults responses are sent back to the PCP within 4 to 6 hours. AristaMD clients report a 30% reduction in ED visits, hospitalizations, and readmissions after eConsult implementation. Measuring these improvements can be simple as focusing on a few metrics within your patient population. For example, hospital admissions and readmission, ED usage, and referral volume, which should decline. You can also boost the health of your patients by increasing compliance and care continuity. With the advice of an expert, PCPs can treat and offer follow-up care. Receiving a treatment plan from a familiar and trusted provider increases the likelihood that the patient will comply. Compliance and continuity are reduced when patients fail to make an appointment or attend the specialist appointment. Only 51% of referrals are scheduled and attended within 90 days. Care continuity is simplified with an eConsult. You always receive diagnostic guidance and treatment advice when using an eConsult. Referral volume is also the appropriate metric for measuring compliance and continuity of care. Key conditions with the population you serve. Preventative care. Patients receive only 55% of the recommended chronic and preventative services. Chronic diseases. About 1/2 of the US adults have at least one chronic condition. 43% of people with diagnosed diabetes have not achieved glycemic control, and more than 80% of hyperlipidemia have not attained cholesterol control. Measuring improvements for patients with these conditions can demonstrate the value of your eConsult program and also indicate a future reduction in high cost utilization. Let's focus on cost savings to your practices. eConsults deliver savings by replacing referrals, reducing unnecessary testing, limiting emergency visits, avoiding hospital readmissions, and offering medication management. An eConsult that avoids specialty referral results in 3 avoided specialty visits, which is the average number of appointments needed to diagnose and treat a patient. Each specialty visit costs approximately $300. The avoided visit savings to an at-risk practice is $900. Approximately 20% of patients have non-clinically indicated duplicate testing, which can be avoided by using eConsults. Average per patient, unnecessary tests and lab work costs around $85. Accounting for the cost of the eConsult, the total cost savings would be $885. This example reflects the cost savings for a typical patient. What if your patient is at risk of visiting the ED, was recently discharged from the hospital, or takes multiple prescriptions? There are more than 139 million emergency room visits each year. The Agency for Healthcare Research and Quality estimates that between 13 to 27% of these visits could be managed outside the ED. Using a conservative 13%, 18 million ED visits could be avoided annually. Across the average patient panel, 137 ED visits could be managed in the primary care setting, a savings of $157,000. This is the single biggest area of potential cost savings from our primary care practice, followed by hospital readmissions. A single hospital readmission costs around $15,000. 14% of patients are readmitted to the hospital within 30 days, and 27% of these readmissions are avoidable. This translates to about 7 patient readmissions within the average PCP patient panel. That's $105,000 annually. If you have a higher percentage of elderly patients or manage high number of chronic conditions or comorbidities, this number could be much higher. More than 56% of patients will experience a drug-related error. Errors related to diagnosis were the most common reason. Not all errors will result in an adverse drug event, but surprising a number will occur each year. The result is more than 1.3 million emergency visits and 350,000 hospitalizations. The cost of an ADE averages $9,900. Patients recently discharged from the ED or inpatient care are more likely to experience an ADE. Only 10% of elderly patients will be discharged on the same medication that they were admitted on. 60% of patients will have 3 or more medicines changed during their hospital stay, while 28 to 40% of the medications are stopped while they're in the hospital. And 45% of medicines prescribed at discharge are new. Consulting a PharmD for a medication review via eConsult following a hospital discharge could save your practice a tremendous amount of money. The typical patient panel will experience 4 ADEs each year, costing your practice $9,900. The total potential savings per provider panel is a whopping $342,000. Multiply $342,000 times the number of providers in your practice, and it becomes obvious that leveraging eConsults will benefit your practice and your patients.